Hello, and welcome to this Beyond Clean virtual conference. The speakers for today's conference, the sponsors for today's conference, and the Beyond Clean team are all so excited that you're here. If this is your first time joining us for a Beyond Clean virtual event, I want to call your attention to a couple of event functions. All of the windows on your event screen are movable. You can shrink them, you can enlarge them, you can move them, whatever you need to do to create the event feel that works best for you. In the upper right corner is a resources tool. Download conference sponsor information and the resources and links that your speakers have provided for you. On the bottom left, you will see a Q&A or question and answer tool. Any questions that you have for the speaker during each session can be submitted to them using this feature. Our speakers today will bring you a wealth of knowledge, and all of their information can be found in the speaker bio tool on the right side of your screen. Along the bottom are the icons for each of the windows as well. Clicking these will minimize and maximize each window. This will be an action-packed conference, and there will be 15-minute breaks between each of the sessions. So feel free to grab a snack, check on the dogs or the kids, assemble a tray, do some jumping jacks, whatever you need to do before joining us again.
All right. Good morning. Happy Friday. My name is Melanie Perry from Beyond Clean, and on behalf of everyone on the Beyond Clean team, I would like to welcome you to our first virtual conference of 2022. We have an amazing year of educational events headed your way, and I am so excited to welcome you to this year's kickoff event. I'd like to welcome back those of you joining us for yet another Beyond Clean virtual conference, and I would like to extend a very warm welcome to those of you joining us for the first time. Joining me this morning is my colleague, Bobby Parker. Bobby, I'd say we have a pretty amazing day ahead of us, don't you think?
Yeah, good morning, Melanie. That's right. Now, today's conference is titled Beyond the Shelf, the Future of Sterile Storage. We've got a dynamic lineup of industry leaders, clinical educators, healthcare professionals who are going to be joining us today for some insightful presentations and some candid conversations that are sure to inspire. Get ready to explore some topics from workspace optimization to the evolving value of data in our sterile processing departments. And particularly, I want to extend a huge shout out to our event sponsor today, One Tray IST, for helping make this exciting day of virtual education possible. I also want to thank CCI for their collaboration on today's event.
Absolutely. And for those of you anxiously awaiting your CE credits, after viewing all of today's live sessions, you will be automatically transferred to the full conference survey. After completing the survey, you will then be prompted to download your 6 CE certificate. But that's not all. I would also like to note during each of today's sessions, you will see bonus content found in the resources window. This bonus content is available to watch and listen to today or on demand at any time that's convenient for you. We are so excited that you have chosen to spend your Friday with us for this educational event dedicated to exploring the future of sterile storage. I understand that you probably have a lot going on between work and home, and I just want to say thank you for being here, for being dedicated to education, for doing something that will help you grow as a sterile processing professional. So we invite you to sit back, relax, maybe start that sterilizer load. It's time to get this event started. We are kicking off this conference with an exciting panel discussion on the topic of managing sterile storage in the OR. Joining us today for today's panel discussion is first Barbara Ann Harmer, who is the Vice President of Clinical Services at Innovative Sterilization Technologies, LLC. She is also the founder and president of Medisys Consultants Incorporated, a highly respected and experienced consulting company for over 32 years. Barbara is a highly skilled, knowledgeable, and visionary perioperative nursing leader. Throughout her career, Barbara's record demonstrates increasingly challenging healthcare leadership positions with exceptional results. She is a highly sought-after speaker for local, regional, and national symposiums and conventions. Our next panelist is Leanne Quint. She is an infection prevention consultant for Galileo. With more than 40 years of experience in the healthcare setting, 30 of those years she has been an infection prevention leader. She is well known for her keen expertise in infection control program design and implementation. She has served on the board of numerous committees, is a published author, and is considered an expert in safety and infection prevention. Our third panelist is Melissa McVaugh. She's the president and CEO of Standardized Sterilization Concept, a company she founded to help health systems identify and eliminate vulnerabilities and improve patient safety, process optimization, and meet all regulatory standards. Melissa's career in healthcare includes various roles such as OR nurse, sterile processing director, and infection preventionist. Melissa is a Lean Six Sigma Green Belt, a member of APIC, and a leadership certification holder from the FBI Academy in Quantico. How do we determine the appropriate locations for sterile items in the OR? What environmental considerations should be met when storing sterile items? Join our conversation as these industry experts identify and describe the current industry standards for managing a regulatory compliant OR sterile storage area. Also, hear critical insights to the development of the AAMI Technical Information Report 109 and its growing impact on transportation standards for healthcare processed items. You'll be glad you tuned in to this insightful discussion. So, without further ado, let's welcome Barbara, Leanne, and Melissa. Good morning, ladies.
Hello, everyone.
All right, I'm so glad you're here. This is going to be a fantastic discussion, and we have a lot to talk about. So we are going to jump right into it. And Melissa, I'm going to throw the first question at you today. We're talking about sterile storage, but what do we mean by sterile storage in the OR? What kind of items are we storing?
Well, the sterile storage area is the area in a facility designed to for the storage of medical devices and supplies. Most facilities have multiple storage areas. This sterile processing usually has the largest with the sterile instruments and some soft goods. But other departments, including the OR and nursing units, also have sterile storage areas. Regardless of the location, policies and procedures for the sterile storage should be developed. So when we're talking about sterile storage, it could be items that are sterilized within the facility or items that you order from outside that are brought in that are sterile. So anything that has the elimination of all microorganisms on them and have been sterilized in various ways is considered sterile.
All right. And to go for right next to the next question in that, Barbara, should sterile items be kept inside an OR where procedures take place? Barbara, I think you forgot to unmute.
I can take that one.
Yeah, go ahead.
Yeah. So, yes, they can be stored very safely inside the OR where procedures do take place. There are recommendations from various regulatory agencies that give us the proper areas, such as closed, covered cabinets that we see quite often in the operating rooms. You want to make sure that you have all of the other considerations with regard to traffic control, but sterile items certainly can be kept and stored in the actual operating rooms. I've seen some open shelving that can be used too. However, you need to make sure where you're actually designing for the open shelving so that there's less traffic control. But during the operation and in between cases, these are covered and away from the turnover of those particular rooms. But yes, it is safe to store those items.
All right. Okay. And Barbara, do you have anything you want to add to that now that you're tuned back in? Nope, you're still muted. Did you click the button under your picture? Okay, well, while she's figuring that out, I will share a little bit of my experience with sterile storage in the OR, because I'm also an OR nurse, and we have to have cabinets or have things covered. And it was always a concern if sterile stuff was in the OR during a procedure, whether or not it might get contaminated or, making sure that it stayed sterile. And so this is a huge concern, just making sure that if you're storing stuff in the OR, that you are actually paying attention to how it's being stored so that it is kept safe and that we're not possibly spreading infection or causing any contamination for other patients. But also not just sterile items that maybe we store in the OR because they, maybe soft goods or whatnot. But when we're opening for a case, sometimes we have hold items, sterile, maybe trays or instruments or things that we're holding because we may or may not want to open them. Where should those be kept during a procedure? Melissa.
I was actually going to defer that one to Leanne since she has more experience with it.
Yeah, so in a case that you were speaking about, maybe in orthopedics, we use a lot of different trays. We have a lot of different sterile packages, and we're not sure if we're going to need them or not. But that back tray, that cart, is really important to use. We can cover them during the time. And if we need them, they're readily available so that we're not having to go back and forth in and out of that operating room. That's another consideration with regard to environmental control. So you really need to have things at your fingertips, but yet if you don't need them, you shouldn't have to open them unless you absolutely do need them.
I think that's part of, as OR nurses, we want to have everything we need because we don't want to have to run back and forth. We don't want to have to run out and all the extra steps. And then, of course, we don't want anybody waiting if there's something that we need. But sometimes I think that lends us to having too much stuff in our ORs as well because we stash things so that we have that or we're hoarding them. And then there's that fine line between having what you need, but then you've got more than you need. And maybe, what do you think, Leanne, about that fine line of over-storing stuff in the OR just to make sure you have it versus making sure you have what you need? Is there a fine line to that?
Yeah, certainly there is. And I think as time has gone on, when Barbara was speaking about designing operating rooms and operating room suites, we've learned a lot over the years with regard to where we can store sterile items and making sure that we do have those proper elements. The piece about the size of the operating room so that we can have enough area to store what we need, but also recognize that outside of the OR itself, there are many different sterile storage areas that are very climate control, limited OR traffic that we actually can have available to us, but really recognizing the cases that you are doing and having everything that you need at your fingertips and not trying to hoard and keep things that I may or may not need. Yes.
Right, definitely. And you mentioned climate control. So what about monitoring the temperature and humidity for sterile instruments kept in the OR? Melissa, should we be monitoring those items in the operating room?
Absolutely, because there's environmental factors that can compromise the sterility of them. So it should be monitored. With a lot of places have it through facilities now that can send a daily report. And then if the temperature or humidity drops out of range, depending on what the manufacturer recommends, then, action does need to be taken. But if there's high humidity in a room, then that can absolutely compromise the sterility, whether it's a peel-packed item or a containerized item. So the regulatory standards state that they do have to be monitored.
Right. Yeah, we had, outside of our ORs, we had little monitors that sat on the wall, and they were green or they were red, and they would always let us know how we were doing with and then our little gauges on the inside too. So anytime that we had an issue with humidity or temperature, everything was calling HVAC and facilities, making sure they fixed it and got it back under control. Do you have anything to add, Leanne?
Yeah, I would tag on to the fact that you're absolutely right. Given the fact that I have had many decades here with operating room environmental control, we have gone great lengths to have technology at our fingertips now. And most of the time, what I see is the OR leadership has that actually right on their phone. There's an app that they can have for 24/7 because it needs to be monitored 24/7. Yes, facilities does monitor that, but when there's an alert, you need to really pay attention to that. It's really time and recognizing what's happening and the surrounding areas as far as what's in those particular rooms, and making those decisions with regard to safe practices. Do we have to pull things out? What's the time limit? What should we be watching? But technology has really been right there helping us along with regard to monitoring that and trending that as well.
Awesome. All right, and Barbara, have we worked out our technical difficulties? No, ma'am. We are still muted. Is the little icon underneath your picture, is that microphone button? No, not clicked. Okay. All right. Well, rats. We will still keep working on trying to get it figured out because I want to have her input on this conversation as well. Okay. So
how about now? Any better?
Yes, ma'am. We have you. Wonderful.
Okay. Well, there you go. I just wanted to add one comment to the conversation that I've been listening to, and that is consistency in recording temperatures are very important. That consistency, the recommendation, it is not a regulation, it is not a standard, but the recommendation is that you do it at a consistent time during the day so that you can average them out to make sure that you're within the parameters that you need to have. Now, a few years ago, the temperature and humidity standards were changed. If you notice, they were taken out of AAMI ST79. ASHRAE got involved and they changed them. And we kind of all played catch up with the two principal manuals that are followed, namely AAMI as well as AORN. And it reverted to the ambient temperature of what the room was when it was designed and built. So for older facilities, that is a huge problem. I've experienced firsthand issues with saying who's got the original design standards and the testing. And in many older facilities, of course, you can imagine they can't find them. So usually when the next testing is done, they'll establish what it should be. And then that is what the ambient temperature is for that particular department. As you can recognize, we all live in different parts of the United States, and we're all in different states right now. And each state is different. Humidity levels, temperature levels throughout the 4 seasons, or if you only have 2 seasons, but it does give you some very individualistic guidelines that you need to be following in your facility.
You're absolutely right. And we actually got a question from the audience about this topic. So I'm going to go ahead and throw it out to you because it fits with what we're talking about. If the temperature or humidity is out of range, for how long until we have to repackage our items? Anybody who wants to take that question is fine.
Well, it's not funny, but if it's raining in your room, you've got a major problem. You've got more than a temperature and humidity. And I've actually had an OR where it was raining in my experience. So it's not a fallacy. It's not, a fun statement that somebody could make. Temperature and humidity, again, you're going to have to see what it is that you're containing in the room specifically where the temperature and humidity is off target. And then you're going to have to see just how bad of a situation it is. If it's fixable within a couple of hours, it's probably not a major issue. But if it is, then the again, suggestion is to remove all the items that are contained in that space until you can go back to a temperature and a humidity within range.
And then to piggyback on that, you should inspect all the packages and see if there's any weakened spots from moisture from humidity on there, or if there's any staining on the packages, I would definitely recommend reprocessing them. Or if you have sweat or any moisture on the outside of the rigid containers. But like Barbara said, the time frame, and correct me if I'm wrong, Barb or Leanne, but I have not been able to find a definitive time frame on that in any of the research that I've done. So when Barbara said about, within a couple hours, I think I have to agree with her on that. And that was a good point. But you have to inspect the packages as well and make sure that there's nothing visible or weakened paper or plastic or moisture on the containers.
Yeah, I'm going to tag on to that as well, Melissa, because from an infection prevention standpoint, we always conduct a risk assessment. So when we're called in, when something's happened in the operating room with regard to they lost their HVAC and that's now impacting their temperature and humidity, we're looking to identify how long has it been, what's been going on, what's the outside temperature, is there going to be an impact with us with our temperature or humidity. So again, if you have 4 seasons or 2 seasons, it really is dependent on a lot of different factors, and that's why IP needs to come in to help with that risk assessment and identify what's the safest way to either remove, temporarily relocate, or recognize that it was a specific period of time, it's now over, and now you've been called in, and recognizing what's happened on the walls, the ceilings, anything that's contributing to any type of an issue with humidity, that you really want to make sure that you're doing the safest practice for patient care.
Absolutely. And just to clarify, when we're talking about it raining in the OR, I've had it happen more than once, but every OR isn't on, the top floor. And sometimes, depending on the plumbing or what's going on with the facility, a pipe breaks or something leaks. And when it leaks, it falls down. And if the OR is underneath where those pipes are, suddenly you have, it is literally, it feels like it's raining because there is water falling out of the ceiling. And it's just like if you have a pipe burst in your house on the second floor, the first floor is going to be flooded. But so to clarify what we mean by raining, we've had it happen actually in ORs. We've had it happen in our sterile storage areas. It's just a part of buildings and pipes and plumbing, and that is a disaster every time it happens. But it definitely has. I think we've all seen it because we're all nodding our heads and laughing, but it's not funny at the time. But it's
and Melanie, I have to say, with regard to that particular types of events, and when we talk to OR leadership and OR staff, and when we're talking about, make sure that we are designing areas, or when we're making decisions of where things are being kept with regard to sterile items, they listen to, oh yeah, we know about not putting them under the sink, we know about not storing them beside a sink, and so forth. But going one step further to talk about the what ifs. What if that something was going to happen? So design it so it's not near the sink, it's not near the plumbing, so that you can at least do that mitigation. And with the risk stratification, you're saying, okay, I'm going to design it so it's farthest away from, so that in the event something does happen, the exact same thing with when people are coming in, environmental services are coming in, and they're doing their terminal cleaning, and when we're doing turnover, all of those things that have to take into consideration so that we're not compromising any sterile products that we do have stored in these operating rooms.
Wonderful. Now I want to dive into the humidity question too, just a little bit further, because another person asked a question, why is low humidity a problem? And that's really something we need to clarify, because everybody might not understand what humidity is doing to our instruments, or why we care about the correct range of humidity in our ORs. Barbara, can you address that? Humidity, why is low humidity a problem?
Well, because humidity will often, in the environments that we're talking about, will start producing water droplets that will be able to be fined if you're especially dealing with peel pouches. You'd be able to see it. It could be doing exactly the same thing if you have rigid container systems that have the ability of water to enter the tray through their filtering devices, and also with wrap. It is permeable, so humidity can cause an issue. But I think one of the things that we found out that was very important, God, it's now over 4 years ago, but when ASHRAE changed what their recommendations were, one of the things that they did was they dropped the percentage of humidity. And so it used to be, if you go back far enough past 2017 ST79, you'll see that the range was 30 to 60%. It actually was dropped to 20%. And one of the first issues that hit the marquees was the fact that there were many products in the market that we were all using that had never been tested nor validated less than 30%. So humidity can be an even bigger deal when it changes.
It's huge, yes. And Melissa or Leanne, do you have any? Yeah, go ahead.
Yeah, and the same goes for, we're very concerned about high humidities, but as Barbara mentioned, low humidity, if you have a constant low humidity, you can have damage to your peel pouches as well, that paper. And you need to have that good range so that you have that ambient temperature and humidity. I've seen that actually in the past, yeah.
So just to add on to that, for our listeners to remember that moisture will allow the microorganisms from the air and surfaces to wick through the packaging materials. So as what Barbara had said, so that's why humidity is also important, because you don't want those microorganisms being wicked into the sterile surface of the inside the packaging.
And then to clarify on the standard, is the standard still 20%? Has it stayed at that lower end for humidity, Barbara? Is that still the standard?
It was adopted 20 to 60%. But again, the fallback was you need to know how your building set was designed, and that's what you should be going by. So in the state of Arizona, 20% might be realistic. In the state of Pennsylvania, 30% might be the lowest that you would ever go, but you have to go back and figure out, if you can't figure out by record keeping what it was, then you'll need to establish what it is currently. And it needs to be not only when it was first designed, or if there's been any modifications to the physical plant since the origination of the design. But that's the key principle to go under. The percentages have been taken out of the books. Hard to find because it won't be there.
Right. The other thing, Melanie, is doing that risk assessment and collaborating with your anesthesia department. That's really important because you can have a lower humidity that may impact them with regard to their care with anesthesia.
Awesome. All right. This has been very helpful. Obviously, temperature and humidity is something that we have lots of questions about, and it's something that affects us with instruments, with patient care, with our ORs, with everything. And it's good to dive into that topic a little bit deeper. Moving over to instrument sets, though, in time, how long should instrument sets be considered sterile? Is there a regulation or a recommendation on that? Leanne?
Yeah, that's one of my pet peeves. Many years ago, when we moved over to event-related sterility, that was a hard concept for quite a few OR leaders and OR staff. They were very set about particular dates and times. And, we used to have these conversations about what's the magical? Why 28? Why 30? Why whatever those particular dates? And then as we educated more about event related and that particular concept, it then became obvious to them that everything else that we do revolves around that event related. And so when we describe event related, it has everything to do with where you're storing, how you're storing it, how many manipulations or where has it been transferred to, paying attention to the integrity of the container, of the peel pouch, is so important. But if you do have event-related sterility program, you need to incorporate all of those elements to make sure that staff really understand that particular concept.
Anybody else have any additional thoughts?
Well, just to clarify for the listeners what shelf life is, or expiration time, but shelf life is the period of time during which a sterile item is considered safe to be used. And a lot of they're set by your policies and procedures, but also by the manufacturer of the different peel packs you may use. Some will support event related, some don't. So you really need to know the IFUs of the packaging that you're using. When you have items delivered to your facility that are sterilized elsewhere, will usually have, like your sutures or disposable instruments, will have expiration dates on it. So if your facility's adopted an event-related policy, then that the shelf life is the period of time which the item is safe to use.
And then let's talk too about, Blue Wrap has an IFU that talks, or the validation date for how long the Blue Wrap is, where, or if maybe your peel packs like you're talking about, there's a time limit, maybe the IFU for the peel pack says sterility is this long. So when we're balancing event-related sterility with what our IFU says, where do we determine the answer, I guess, for how long is an item considered sterile? Because there's actually some disagreement there between event-related and then the packaging IFU or the Blue Wrap IFU says it'll be sterile this long. So Barbara, can you maybe dive into that a little bit?
Sure. So once an item has been cleared by the FDA with storage, then it's the organization's choice as to whether they adopt event-related or expiratory dating. The odds on is that there's probably about 97 to 98% of organizations, healthcare organizations in this country, that have adopted event-related. And the first thing that event-related tells you is that it is not time-related. So if you have a peel pouch that says the validation or the clearance was for 6 months, if you adopt your policy in writing that says event-related means that until there's an event that occurs that renders it unsterile or compromised, we go down the whole litany that has already been discussed, the number of touches, how you store it, where you store it, all the different, what the viability of the item is. Like a peel pouch is certainly much more fragile, if you will, than a rigid container, okay? But if they're both stored underneath a big hole in your ceiling, it doesn't really much matter, right? But event-related is an adoption of a practice that is permissible right now, and the organization can choose one or the other. If you're event-related, again, it is not time-related. There is no date. There is no expiration date on your package. It is strictly a sterilization date. But if you're expiratory dating, then, of course, you follow the IFU of the packaging system or sterile barrier system, and that's what your organization should adopt. But again, if anything ever happens, the package is no longer a friend to you and it needs to come down immediately, whatever your policy is. And I think that sometimes is missed.
I think so. Anything else, Melissa?
One important thing to remember on that is that the probability of contamination does increase with time, but it's, as Barbara said, it's more influenced by the handling and the storage methods, more so than the time.
And in that same vein, when we're talking about sterile instruments, should they ever be transported outside of the facility for use at another site? We know it happens. all the time, especially in these bigger facilities that have multiple campuses and multiple locations, or vendors grabbing trays from one hospital to go run it over to another hospital. But should that be happening with our sterile trays or instruments? And if it can or should, how should that be happening? Leanne.
So I've experienced this when we have healthcare systems. So the answer from an IP perspective is yes, they can, if they are safely transported and there are real policies and procedures out there on that process. So if you meet each one of those steps, and making sure that you have the right container in which you're going to be transporting it, who's transporting it, how are they transporting it, if it's a vehicle, has that vehicle been inspected for a proper transport? There's so many factors involved, but yes, the policy and procedure should drive that safe ability to transport a sterile item from one facility to another.
We always had one set of rules for how it was supposed to be done if there was time to do it a certain way. And then it seemed like there was always a different set of rules for when we needed it right now or needed it 5 minutes ago, and it just needed to show up. And so instruments would have to be, if we were going to use them straight coming from one facility, brought over to another in a hurry, they would double bag it and bring it over. And then we could just run it right down to an OR and use it if we needed to. But in general, if it came from one facility, brought over to another, it needed to be unwrapped, it needed to be rerun, reprocessed, and follow all of those steps. But then if it was an emergency, we didn't do that because we didn't have time. So I guess I'm curious the difference in the practice between doing it one way when there's an emergency, we have to have it, and then doing it another way when we're just planning for cases. Is there really a best practice or a better way to do it, or is it really just based on facility policy? Melissa, what do you say?
Well, it depends on the policy that the facilities have adopted. But yes, you can transport instruments from one facility to another. So the AAMI standards, spell that out pretty clearly with the use of maintenance sterility covers, monitoring the temperature and humidity within a vehicle. If there's sterile instruments being transported, then the vehicle can't be left unattended. There's so many variables that are involved in that. But if a policy adopts that, then whether it's an emergency or a case that's for the next day, you absolutely can transport the instruments safely, sterile between facilities.
Barbara, do you have anything to add?
Yeah, thank you. I was just going to add that in surgical services, we're used to emergent and urgent situations. However, the rule of thumb always, at least I can speak to my own facilities, is once you develop a consistency and standardization, you don't veer from that. It's very rare that you would have to. There's always the allowance for that, but you better have a darn good reason, quite frankly. Mm-hmm. But your policy should be what you're doing. And if not, from my years of surveying, then you need to change your policy. But you can't say, well, this is good for Monday, but it's not good for Wednesday. That consistency is what's needed. And that's what really confuses staff, is when it's okay one day, but it's not the next day. So that standardization is essential.
Yeah,
we talk about and just tagging on to that, that's about variation, right? And as Barbara said, standardization is the standard work, and that is the culture of the organization, and to ensure that they are following that process. And having policies and procedures and education and training with regard to if it's a standard work from one facility to another, or if it's an emergent, urgent, there are policies and processes that we have to go by.
Yeah. I can really speak to that from a staff standpoint and from a team leader standpoint. When it came to not being consistent, it was very confusing. And we had a policy to follow. It was supposed to be done this way. It was supposed to come through the sterile transporter, and it had to come from the main campus over to us, and it needed to be reprocessed and rerun. But then, it's 6 o'clock, 6:30 on a Wednesday night. Nobody's in sterile processing that's in management. It's just, people finishing up for the day or whatever, and we need a tray. What are we going to do? Well, the rep that needs it knows it's over in the other facility. They're going to run over, they're going to grab it, and they're going to double bag it and bring it. And is this okay to use? Can we do it? And they're like, well, we do it over at the other campus, or we do it at the other place, and we've done it before. And there was just a lot of inconsistency with what was sometimes allowed and what wasn't allowed, or maybe even dealing with the management team. Sometimes they would say, no, we have to follow this. And sometimes, okay, we'll just go ahead and do it just because we need it. And not having consistency really did leave staff confused as to what was allowed and what wasn't, or was it okay, or was it not okay? So I really agree with having policies that we have, but then also having policies that we follow and we're consistent with gives us a standardized level of care that everybody's familiar with and understands.
And the
I
other
think
thing
with Barbara being a previous surveyor, she can agree with this, but it's the inconsistencies that would get you cited and not following your own policy and procedure.
Yes, very much so,
Exactly.
Melissa.
and the
So
other
I guess
thing too,
maybe this is a good jumping off point to mention that exactly this conversation is what's led AAMI to take on the subject of external transportation of healthcare processed items. And it just doesn't mean outside of the facility. It could be even within the facility. And it's a new technical information report that's been given the number of 109. And so we are in development currently. Lots of subcommittees that have been working on it. We're dealing with regulatory considerations, personnel considerations, space considerations, the environmental considerations that we've already spoke about. There's a whole litany of topics that are going to be discussed in this technical information report. We're working feverishly to get this done. The nice thing about a technical information report, or TIR, is that it doesn't have to go to the AAMI board for approval. It's a consensus document, meaning that healthcare practitioners, vendors, the individuals that sit around the table will sit down, and we've been commenting on the document, and we're hoping that it'll come out. The process is still laborious, but we're hoping that it comes out shortly, because it's that guidance that we really are lacking. We've been doing it all different ways. I can tell you, back in the 70s, we used taxis. Now, can you imagine a clean taxi for all the taxis that you've been in? So it is a long-standing issue, concern, but when you need something and you know you need it, you find the path of least resistance to get it to you. So we are very hopeful, those of us that are sitting on this subcommittee developing this, that it will certainly have major impact. Again, since AAMI is a voluntary document, which a lot of people don't recognize, but AAMI says it right in the beginning of their preface. It's a voluntary document. And that voluntary document is, again, there's lots of shoulds and coulds and woulds, but there are very few musts. So be very careful when you read any of the documents and apply it to your circumstances. There needs to be an element of common sense with all of the policies, procedures, and processes that we develop.
Absolutely right. Leanne, did you have something else you wanted to add as well?
No, I think, as Barbara has said, this has been a long-standing, and now with loaner trays coming into facilities, there's so many other caveats that have been impacted by, it's not just coming from central sterile into an operating room. We have healthcare systems that have so many other clinics off-site and require sterile items. So the rationale behind the why that staff need to understand how critical a sterile item truly is, and why it needs to be sterile while it gets to the patient. And again, risk assessments are so important from an IP standpoint. As Barbara said, we have to have some common sense, but work through that process, so the transportation process, whether it's inside the facility or outside the facility, you have to really be able to make sure that if you are following the travel and you're asking yourself, where could the gaps be? Identify them and make sure that you have a solid process for safety.
Very true. Melissa, anything else you want to add on this topic?
No, just the biggest thing is, just adhere to your own policies that you have.
Absolutely. I want to switch gears just a little bit because we're getting to the end of our time. But all of you have been in the OR. You know what it's like in the OR when you go in and you see the cabinets or you see the drawers or the shelves, whatever they have, and sterile soft goods, or maybe there's a row of peel packs or something. But going back to mentioning hoarding earlier, there might also be a sling stuffed onto a shelf with sterile items, or there might be a bunch of tape, or there might be, I don't know, you name it, buckets so that they can go get water for dressings or whatever. But anyway, ultimately what we have is we have unsterile and we have sterile crammed in together on shelves so that everything is there that the circulator or the scrub tech might need for the case. And we all know that you can't store sterile and unsterile together. I want to talk a little bit about that. What's wrong with that? Why should we not be storing sterile and unsterile items together on shelves in our operating rooms? Melissa.
Well, there's several reasons for that, and you should always have the clean supplies and sterile supplies stored on separate shelves, sterile being above the clean. And then I think Leanne, from her infection prevention background, can probably explain more detailed as to why.
Well, first of all, clean is not considered sterile. And so when you're looking at your sterilization process and you're handling your sterile goods and you're storing them in a safe manner, you have to figure out where those other clean supplies will be stored. As Melissa said, be creative with regard to making sure that they're separated. There's special bins that you can put your sterile items in. But when you see those kinds of observations where you have a mixed match of things, you absolutely know at that point in time that is not best practice and that you have to educate the why behind a sterile item should be stored and how it should be stored. And not even cramming those in. We haven't even talked about the fact that what we see in certain sterile areas, cabinets and open cabinetry, that people want to really get everything in there, and they don't allow for the breathability. They don't allow for the consideration of jamming something up against a wall, what accumulates dust. So there's so many factors about making sure that you are designing and keeping those sterile items very safe in a very controlled environment, and traffic control and dust and all of that comes into play. So that's just, again, a common sense piece. What is clean and what is sterile? And if someone has done that, they haven't paid attention to the fact that they have a very controlled area where sterile items are being placed, and minimizing the hands-on for that until you're ready to use it.
So if I can just give you a historical perspective, traditionally when ORs were designed, there was a sterile storage area and there was clean supply storage. Yep. And unfortunately, with the development of ASCs, which now span over 40 years in the U.S., but with the development of ASCs, there was never enough storage space designed. And so Medicare actually loosened the requirements. And with that came the advent of mixing sterile and clean items together. I'll just add an anecdotal note right now and tell you that those of us have been kicking around for a very long time can share that it doesn't work. It needs to be separated because unfortunately, all of the hands that touch all of the items do get confused, and they put clean items on the same shelf with sterile, and they'll house leg holders in the same room, and it becomes a catch-all for anything that you can fit on an open shelf. And I will share with you though that new construction, there are many new designs that I have reviewed recently that are separating again. They are keeping sterile, clean with clean, and dirty with dirty. And if that becomes your mantra, it's hard to mix it up because you can stand in front of any shelving unit and say, wait a minute, sterile with sterile, there's a bunch of other things on this and it shouldn't be that way. It should be clean with clean, sterile with sterile, and dirty with dirty. But it has gone through an evolutionary change. And for those people that made common areas, if you will, for sterile and clean, they're going to continue to have these issues.
I agree. I ran into it going through the ORs I was in charge of. I would see it all the time. I mean, orthopedics there's a lot you need in orthopedics, and there's a lot of clean items that you go and grab or you might want, but I would always find them stuffed into those shelves on the same shelf as sterile soft goods or other things. And it was just because the shelf was there. It was an open shelf. So let's just put it on the shelf. And then anytime we were getting ready for a surveyor or somebody else to come inspect, it was hurry up and clean these off because this isn't right. And but I think really good delineation between sterile, clean, and dirty would be very helpful because you would know, well, I can't put this here because it's not sterile, or I can't put this here because it's not X, Y, or Z. That would definitely be a helpful separation.
And Melanie, I think I'd like to point out that what I have seen in my career is we have so many packages of sterile items, but we don't have enough storage for sterile items. Mm-hmm. So that's where you'll see packaging and trying to store something, jamming it in there and not paying attention to the height, how much breathability you need with those containers, or closed closet versus open closets and bins. People really stuff things in. And I take pictures. Because pictures tell the story, mm-hmm. and they show how that can happen. When you pull something out and you need it, and it's under a blue wrap, and that wire frame that you have it tucked right, jammed right in there, and you're pulling it out, you don't even realize that you actually made that tear yourself. And hopefully it will be inspected when it gets onto the operating room table, and they will reject it. But those are some of my pet peeves with regard to, yes, we have sterile storage areas, but when we start to pile them on because they're telling me they don't have enough space, then we have to rework this and rethink what it is and how much we have. And do we actually need all of that in that area all at once?
Right. All right. I think we've got time for one more round of your thoughts. And I want to just hit the broadest topic and hear what all of you have to say. We've talked about it. We've hit on it already. But just in general, best practices for storing items in the OR. What are your biggest takeaways or things to share with our audience about sterile storage best practices? And whoever wants to go first.
So let me speak to the individuals who might be watching this or listening to this at some point, who are in the midst of or beginning a building project. One of the key things is about storage, and I've been thrilled that Beyond Clean has done an entire session on storage because it's been one of those topics that is the last step, if you will, in the sterilization process. You can go through all this work and sterilize something and then store it improperly. And all that good work has gone for naught. But storage does not equate to revenue. And that's the way architects think about it, which is why we all struggle with storage. Recently, I wrote an article and I opened up with, does everybody have enough storage in their house? And the absolute answer is no, nobody ever has enough storage. Well, in healthcare organizations, there's even less. And the reason is because it doesn't produce revenue. So I'd like to start a new cult in the country. And that is, we need to stand up to the architects. And I'm not making them bad people. They just don't know because they've never walked a minute in our shoes. And we need to stand up to especially architects and to the owners, whether they be healthcare organizations or physicians, it doesn't matter. But I'm going to go out on that limb and say, if you don't have adequate storage, you're not going to produce revenue, because we are all about turnaround time. And as everybody has said during this panel discussion, it can't be stored improperly, as Leanne just finished, as Melissa refers to the different processes that you need to develop, and they need to be consistent. We need to have enough storage. And so we need to sing from the pulpits about enough storage if you have the, the advantage of developing something from the beginning or the rework of a department. Storage is revenue, and without it, you're going to interfere with the delivery of care, because ultimately you're not going to be able to do what you need to do in a timely and efficient fashion.
It's very true.
And one thing I would like to add that we didn't discuss with the sterile storage areas is the cleaning of them. And they really need to be put on a cleaning schedule, because if they're not, then they tend to be missed in the cleaning process. And so that's a real important factor to sterile storage as well.
Leanne, anything you'd like to add?
No, I think we've covered everything. I really love the fact that being proactive, if you have that opportunity, if you're doing any redesigning, just being able to take a look at your OR volume and be able to say what kinds of sterile containers that you're using. Are you using more rigid containers than peel packs? So that's going to really drive the location and the amount of storage that you are going to need. It's really not that difficult to come up with that quantitative measure so that you can show the architects and you can show the leadership the rationale behind that.
Absolutely. Yeah, I helped build a hospital early in my OR nursing career. And every time that they went through reiterations of the plans and they would look at the space for storage, they would always say, well, this is so big. Do you really need this much space? And it seemed like every time they went through it, we lost more space and lost more space. And what they said was huge storage. As soon as we moved into that OR, it was already not enough. We already from day one did not have enough storage. And so I really agree with the thought that sterile storage and having enough storage is going to help your facility. It is your revenue. I mean, we need to have enough storage in order to do the job that we do. And here's one more question. It's just a little humorous, but I'd love to hear what you say about it before we go. If tear-resistant ladies' tights exist, how is there not a tear-resistant wrap material? Does anybody know that one?
That's a very good question. I don't think I can answer that, but I can follow up with another question. With the technology we have today, how come we don't have any type of indicators on the wrappers or that will change a color if the sterility had been compromised?
That's also a very good question.
Again, one that I can't answer.
I can't answer that one either. But this has been a wonderful discussion. I have enjoyed it immensely. And I just want to say thank you for giving us such a great discussion and for providing so many key insights into sterile storage and to sharing your experiences and sharing your wisdom and knowledge with all of our listeners. And I want to thank everyone for joining us, for your engagement. I know we didn't get to every question, but we tried to catch them as they came in. If we didn't get to yours, we will make sure that the speakers receive your questions. And you can also connect with them via email or LinkedIn from their contact information on the screen. Now, after this session, your screen will automatically transition you to the next session. But as a reminder, there is a 15-minute break between each session throughout the conference today. The registration page appears and you've already registered. Just click the already registered link and enter your email address again to enter the next link. But thank you so much for joining us, ladies. Thank you for being here, and we will see you all in the next session.
Thank you.
Goodbye.
Thank you.
Thank you.